Margaret called her daughter on a Tuesday afternoon to say she felt perfectly fine. She had just come back from her morning walk, made herself a bowl of oatmeal, fed the cat. Completely normal Tuesday. By Thursday morning, she was in the ICU. No warning, no dizziness, no chest pain, nothing that would have made her or anyone think something was wrong. And here's the part that still stays with me. Years later, the warning signs were there. They just weren't being measured. Not by her doctor, not by her morning readings, not by anything in her routine care. They were happening at night, while she slept, while she dreamed. I'm Dr. Adriana Markson, and today I need to talk to you about something your doctor almost certainly has never checked, and why, if you're over 60, it may be the most important conversation you haven't had yet. Stay with me. What I'm about to share could genuinely change what happens to you. Margaret was 67, retired school teacher, active, sharp, and careful about her health. She came to see me about 6 months before that Tuesday. Her blood pressure at the office? 118/76. Textbook perfect. Her doctor was pleased. Her family was relieved. She was relieved. But something nagged at me. She kept mentioning that she woke up tired, not occasionally, but every single morning. Head a little foggy, like she hadn't actually rested. She assumed it was just aging, just how sleep goes after 65. I asked her to wear a small monitoring device for 24 hours, just to see. What came back stopped me cold. At 2 a.m, while Margaret was sound asleep, completely unaware, her blood pressure was 171/108. That's not a mild elevation. That's a hypertensive crisis. Happening silently, night after night, while her morning readings looked perfectly reassuring. How does this happen? And why does it happen to so many people after 60? That's exactly what I need to explain, because once you understand this, you'll never look at a routine blood pressure reading the same way again. Here's something most people don't realize about their body at night. Under normal, healthy conditions, your blood pressure drops during sleep. About 10 to 20% every single night without fail. Doctors call this the dipping pattern. And it's not just a number, it's your body doing critical maintenance work. Your heart repairs itself. Your blood vessels recover their flexibility. Your kidneys process the day's waste. Every one of those processes depends on that pressure coming down. Think of it like a factory that needs to power down at night to do repairs. If the machines never stop running, the wear builds up. Things start breaking down. Now here's what changes after 60. Your arteries gradually stiffen. The nervous system that controls that nighttime pressure drop, the one that sends the stand down signal, starts losing its precision. The signals get weaker, less reliable, less consistent. And for more than half of adults over 65, that nightly dip simply stops happening. The pressure stays elevated. Or, in some cases, it actually climbs higher during sleep than it was during the day. We call these people non-dippers. And the numbers are not rare. They are the majority. But here's what that means for your risk, and this is where I need you to really pay attention. Non-dippers, people whose pressure doesn't fall at night, carry 3 times the cardiovascular mortality risk of people with identical daytime readings. 3 times. Same morning number, same medication, same diet, but 3 times the risk just from what's happening during those 8 hours of sleep. And there's an even more dangerous pattern I see. Reverse dippers. People whose pressure actually rises during sleep, higher at night than during the day. For those individuals, stroke risk increases by a factor of 4 or 5, and they feel completely fine at their office visits. Margaret was a reverse dipper. Her morning readings, the ones her doctor had relied on for years, were hiding the real picture entirely. I've stood at bedsides after major cardiac events. I've had those conversations with families. And in so many of those cases, especially in patients over 60, the warning was already there, in nighttime data that was never collected, in a test that was never ordered. So why isn't this being caught? Because your doctor is making decisions based on 30 seconds of data. 30 seconds. Out of 86,400 seconds in a day. That's your entire cardiovascular risk profile. A single snapshot taken in a clinic while you're sitting in a chair in the middle of a Tuesday afternoon. That snapshot has almost nothing to do with what happens to your heart between midnight and 4 in the morning. And it gets worse, because there are things right in your home, things you'd never suspect, that may be actively pushing your nighttime pressure higher. And I'd be willing to bet at least one of them is in your kitchen right now. Let's start with your evening tea. Licorice root. I know, it sounds completely harmless. Herbal, natural, soothing before bed. Many of my patients drink it precisely because it feels gentle and calming. But licorice root contains a compound that blocks a specific enzyme in your kidneys. When that enzyme is suppressed, cortisol, your stress hormone, builds up in your bloodstream overnight. And elevated cortisol at night drives your pressure up. You won't feel it. You'll just wake up exhausted and wonder why you're so tired when you slept a full 8 hours. Check your label tonight. Licorice root hides under several names: glycyrrhiza, sweet root, and vaguely as natural flavoring in herbal blends. The second culprit? Evening alcohol. I know this one is harder to hear. A glass of wine with dinner feels harmless, and honestly, the initial effect is a mild pressure drop. But 3 to 4 hours later, right in your deepest sleep, your nervous system overcorrects. It surges. Your cortisol spikes. And your blood pressure can hit its highest point of the entire day at 3 in the morning. Every time. Not occasionally. Every single time you drink in the hours before bed. Third, grapefruit juice, specifically if you take amlodipine or similar calcium channel blockers. Grapefruit blocks the enzyme your liver uses to process these medications. What was designed as a controlled, gradual release becomes unpredictable and prolonged, especially dangerous at night when there's no one watching, no way to respond. Now, what do you do about all of this? After Margaret wore the monitor and I saw her results, we did 3 things. We ran tests most doctors never order. A urine microalbumin test, which detects tiny amounts of kidney stress protein that appear years before damage becomes visible on standard tests, and an oxidized LDL panel, which measures arterial wall damage directly. Her results showed early signals in both. Quiet warnings that had been building. Then we talked about when she was taking her blood pressure medication. Like most people, she took it first thing in the morning. But most blood pressure medications peak in effectiveness within a few hours of being taken and then steadily taper off. By midnight, the protective window has significantly narrowed, right when her pressure was spiking. There's a landmark study on this, the Hibiscus chronotherapy trial. 20,000 patients. 6 years of follow-up. Researchers compared taking blood pressure medication in the morning versus at bedtime, with everything else identical. The bedtime group had nearly 50% lower rates of heart attack, stroke, and cardiovascular death. Same drugs. Same doses. Just a different time of day. I must be clear, do not change your medication timing on your own. Some medications, diuretics especially, should absolutely not be taken at bedtime. This is a conversation for you and your doctor. But it is a conversation absolutely worth having. One question could change your entire outcome. We also added one simple, evidence-backed habit to Margaret's evening routine, hibiscus tea. Not as a replacement for her medication, as a complement to it. Hibiscus flowers, specifically dried Hibiscus sabdariffa, contain compounds called anthocyanins that work through the same mechanism as a major class of blood pressure medications. Multiple clinical trials have found consistent reductions of 8 to 14 millimeters of mercury in systolic pressure in patients with mild to moderate hypertension. But preparation matters. Most people make it far too weak. Use 10 grams of dried hibiscus flowers, not tea bags, not blends, actual dried flowers. Heat your water to about 190 degrees Fahrenheit, just below boiling. Steep for a full 10 to 15 minutes. When it's brewed correctly, it should be a deep, rich burgundy, almost like dark red wine. If yours looks pale pink, steep it longer. Drink it 1 to 2 hours before bed. That's the timing window with the most meaningful impact on overnight pressure. And if you're already on blood pressure medication, tell your doctor before adding hibiscus. Even natural compounds with real mechanisms interact with real drugs. Tell your doctor. It's that simple. 6 months after we made those changes with Margaret, after switching her tea, adjusting her evening wine timing, changing her medication schedule, and adding Hibiscus, her overnight readings had transformed. Her morning fatigue? Gone. Her energy? Back. She still has her cat, still makes her oatmeal. But now we know what her heart is doing at night, and we're protecting it. Let me bring this together clearly, because I want you walking away with a specific plan, not just information. Your daytime blood pressure reading is a starting point, not the whole picture. Nighttime pressure is equally, often more, important. More than half of adults over 65 are non-dippers, carrying 3 times the cardiovascular risk of people with the same office reading. And routine visits catch none of it. Check your home tonight. Look for licorice root in your evening tea listed as glycyrrhiza, sweet root, or natural flavoring. Be honest with yourself about evening alcohol. And check your medications against grapefruit juice if you're on a calcium channel blocker. Write down 3 test names. Right now. 8 p.m. ambulatory blood pressure monitoring, a 24-hour cuff that captures your true nighttime profile. Urine microalbumin, an early kidney stress signal that appears years before visible damage. Oxidized LDL, a direct marker of arterial wall injury. Fold that paper. Put it with your insurance card. That is your entire agenda for your next appointment. Ask your doctor about bedtime medication timing. 1 question. 30 seconds. Potentially a 50% reduction in risk. It is worth asking. Consider adding properly brewed hibiscus tea to your evening routine. 10 grams steeped deep red 1 hour before bed. With your doctor's awareness if you're on medication. Has your doctor ever asked about your nighttime blood pressure? Have you ever worn a 24-hour monitor? Leave a comment below. I genuinely want to know. Your experience helps the people in this community know what questions to bring to their next appointment. And if this reached you today, I want to ask one small favor. Share it with someone over 60 whom you love. A parent, a spouse, a close friend, a neighbor. This is exactly the kind of information that falls through the cracks between appointments, and your share might be the reason someone asks the right question at exactly the right time. Subscribe if you want to go deeper. We are just getting started. And please remember, everything I've shared today reflects current research and my clinical experience, but it is not personal medical advice. Your situation is individual. Your medications are specific to your history. Before changing anything, your medication schedule, your supplements, your diet, please talk to your own physician first. That conversation is not a formality. It is the whole point. Take care of your heart. It has been working for you every hour, every night, without rest, without complaint, for every decade of your life. The very least we can do is pay attention. I'll see you in the next one. Until then, take exceptional care of yourself and of the people you love.